Hi guys, I thought some of you might be interested in how the virtual appointment works. So what we do is, I've just been ringing around and chatting and talking to people, and they say, I say, how's your problem, what's going on? And they say, I've been doing my exercises, and they give us a bit of an update on where they are. And I was like, okay, I think you're doing okay, work on your exercises, see what happens. The thing is now it seems that we can't really kick the can down the road now, because I think we're going to be locked down for a long time. So some of those problems that I thought, we can push off for a few weeks, it doesn't look like that's going to be able to happen. So I kind of then have rung a few patients back and say, look, I think we probably need to try and put some virtual appointments in. I make sure they get a foam roller and bits and bobs, which is kind of really helps us direct our treatment. So we get them to download an app onto their phone, a tablet or computer, ideally two things, but one thing's fine. And that allows us to do have a chat about a subject of interview, so a chat about what what your problem is and how it's been going, how your exercise is, like we do normally in the clinic. And then once we've done that, we then perch it up. You stand looking at the door like you do in the clinic, but what we do then is reproduce that with a camera looking at your posture. We look at your posture and see how you're standing and how you're weight bearing. We go through some movements, we can see how your movements are going, and then from that we can then work out what we're going to do as far as those mechanical treatments are concerned. So we can see what we've done in the past, and then we can use those combinations of treatments to reproduce those outcomes for you now. So the treatment actually follows through quite nicely, and those treatment plans can be extended through that using foam rollers and inhibition techniques. It's not exactly the same as us, and we can't do all the techniques that we would normally do, but most of the patients and I myself are very impressed about the outcomes. It's getting good results, far better than I thought I was going to, so I'm really pleased with that. The patients are enjoying it. I'm seeing all their family and animals as well, so it's working really well. And at the end of it, I can then give them a bit of advice on going forward, what's going to happen as far as self-help. So very similar treatment pattern what we do in the clinic, but we're just reproducing it at home in different ways. The outcomes are very good, as I said. So what we're going to do is just try and contact some of our patients and to try and get those booked in. For you guys, if you're interested, come back to me by email or phone call. It is all me now, so you can contact me directly, and that way we can book you in and carry on those treatment programs you've been on, because I don't think that we're going to be able to try and push these problems down 2 or 3 weeks' time, because I'm not sure that we're going to be out of lockdown. So we'll make sure that we keep those standards up, because sometimes what will happen is without the appointment times we're looking for, your treatment might start to go awry, and it's going to be hard to get back on top of it. So if you're interested in the virtual health appointments, which actually are becoming really popular, then give us a call. Have to bear with us a little bit. Make sure you get a foam roller, a spiky ball that's going to help, and that way we can then formulate a plan and get a treatment appointment in place for you going forward. So anyway, I'm loving doing the virtual appointments. It is amazing to see my patients and still see some improvements in these mad times. It's brilliant that we're still helping people. So take care, guys. Hopefully I'll see you virtually soon. Bye bye.